I suppose the sugar, the high intake of sugar and high sugar consumption has always been very topical in cancer care, because there is this idea of cancer cells do need glucose to metabolize. And a lot of people argue that the more sugar that somebody consumes over a protracted period, so we're not talking about somebody having sugar on weekends only, it would be a significantly high consumption. They do say that can potentially put people at an increased risk. So that's very topical at the moment. As well, we're looking at other ways to support patients with cancer. For example, I've worked with a lot of patients with head and neck cancer that have PEG tubes. So it's about enabling them to live a normal life with their varied diet. So patients who are being fed through their tummy, who, for example, can no longer eat and drink at a table with their families, or can no longer eat and drink at a table when they're out in public, how to normalise PEG feeding by, I suppose, doing more health promotion in the clinical and the public setting as well. Yeah. And also what's interesting, I think, is the promotion of nutrition for homeless people. So there are often groups of minority people that are not targeted in the media because they're not seen and they're not as popular, but they're definitely a patient group that we need to be aware of as well.